For San Antonio at 10.
A local community plagued by the pandemic. We're here for you, looking into why one particular area is getting the worst of it and what's being done to contain the virus. And new research about just how far COVID-19 can travel outdoors, how weather conditions could affect your risk of infection.
And right now you are taking a live look at Cleveland, Ohio, as making headlines. You saw the first presidential debate between President Trump and Joe Biden, and something like as was expected, it got heated and it got personal. How the two took to task each other on a number of issues: records on the Supreme Court, the economy, race and violence in American cities, and the pandemic. And COVID-19 did bring changes to tonight's format anyway, the two not shaking hands as a health precaution. The audience also limited just about 70 people, with an estimated 100 million Americans watching from home.
We are here for you to keep you informed. We're just 35 days out now from Election Day.
And if you missed any of tonight's big debate, we have you covered with team coverage right now. Our chief political correspondent, Scott Thuman, begins with a quick look at tonight's highlights.
Quickly, it was masks off and gloves off in his first presidential debate.
The fact is that everything he's saying so far is simply a lie. I'm not here to call out his lies. Everybody knows he's a liar.
But you
I just want to make sure.
Joe, you're the liar.
I want to make sure.
You graduated last in your class, not first in your class.
God.
The handling of coronavirus, a contrast that defines their differences.
We're going to deliver it right away. We have the military all set up. Logistically, they're all set up. We have our military that delivers soldiers, and they can do 200,000 a day. They're going to be delivering.
This is the same man
it's
who
all
told
set
you
up.
by Easter this would be gone away. By the warm weather, it'd be gone. Miraculous, like a miracle. And by the way, maybe you could inject some bleach in your arm, and that would take care of it. This is the same man.
That was said sarcastically,
that was,
you know that. That was said sarcastically.
And criticism over how much, or rather little, President Trump paid in recent years in federal income tax.
I paid millions of dollars in taxes, millions of dollars of income tax. And let me just tell you, there was a story in one of the papers. I paid $38 million 1 year. I paid $27 million.
Show us your tax returns.
I went. You'll see it as soon as it's finished.
And they provided a preview over the fight to fill the Supreme Court vacancy. And if Democrats have the power, would they add more justices to the court?
You're going to pack the
Make
court?
sure you, in fact, let people know you're a senator.
I'm
not going to answer the question.
Why
because,
would you answer that
because
question?
the question is, the question is,
radical left.
Will you shut up, man?
Listen, who is on your list, Joe? Who's on your list?
Immediately, it is back on the campaign trail for these two starting Wednesday morning, and they will have a week off from debating. The next term belongs to Vice President Mike Pence and Senator Kamala Harris, who will face off October 7th in Salt Lake City. In Cleveland, Scott Thuman. Now back to you.
The debate, to me, is like reality TV.
Tonight, we're letting you sound off on how you think tonight's debate went. Who won, who lost, and ultimately, does it even matter? That's the big question right now. Many are wondering.
Will tonight's debate actually sway any voters out there? And tonight, News 4 San Antonio's Robert Price watched along with San Antonio voters trying to find out.
President Donald Trump
There's nothing smart about you, Joe. 47 years, you've done nothing.
versus Joe Biden.
I'm not here to call out his lies. Everybody knows he's a liar.
The crowd watching at Luther's Cafe near San Antonio College hung on every word.
The debate, to me, is like reality TV.
I'm sitting down, watching the game, seeing the two sides come together and going at it. This is our Super Bowl.
Political scientist Dr. Andrew Sanders of Texas A&M San Antonio says seeing the president on the same stage with the former vice president has value.
So we should never completely dismiss the debates.
He just wonders how much value.
Generally speaking, political scientists are a little cynical as to the purpose of debates when it comes to swaying voters. It's very likely that most voters have made up their minds, but as we saw in 2016, it only takes a very small margin of voters to go one way or the other to decide an election.
Back at Luther's,
I think by now a lot of people have their mind made up.
They're on two opposite ends of the spectrum. If anybody's in the middle and not sure right now, I probably don't believe them.
one debate down, two more to go. Moving forward, both candidates better bring their A game in a format where style often wins out over substance.
Speaking is 70% how you say it. and 30% what you say.
Justice, radical left.
Will you shut up, man?
Listen, who is on your
Because
list?
we need to remember that clips from this debate will be chopped up and shown on news stations, they'll be shown on social media, so there will be an element of style. It will be important for the candidates to get in the odd zinger.
And as we've seen, there were quite a few zingers. On the flip side, though, Dr. Sanders says with so many people watching tonight, those undecided voters could start leaning a certain way based on which candidate they felt offered more substance on key issues. Irene?
The numbers of cases that we report one day to the next do go back and forth, and we are reporting a significant number of cases tonight.
That number is 469 new COVID-19 cases. This is a significant jump from the numbers we've seen over the past several days. Mayor Ron Nirenberg explaining that a bulk of the new cases are from batches of test results sent to Metro Health a week after they were completed. 207 cases date back starting 2 weeks ago from September 15th to September 23rd. That is why city and county officials say it is important to look at the 7-day moving average to get a better picture of the community's progress. That average is now at about 178 cases daily.
As for total now, since the start of the pandemic in Bexar County, there's been a total of 57,677 total infections. Also tonight, we've learned of 5 new deaths reported. That death toll, 1,135. And working for you, we are keeping you informed about the latest efforts to fight the spread of coronavirus right here in this community. And tonight, News 4 San Antonio's Darian Trotter talked with one city leader about the efforts she's making in her district to ultimately help keep you and your family safe.
Construction crews, restaurant staffers, and grocery store cashiers are among frontline workers at greater risk of coronavirus, something Councilwoman Shirley Gonzalez knows all too well.
It has been really horrible for us here in the district, all the fatalities.
According to census data, the majority of people in District 5 work in service industries.
I got to make money and I got to provide for myself and stuff like that.
Eric Padilla has been worried about getting sick on the job.
Working construction, you got to work with people next to you and stuff like that.
Juana Delgado says her family expresses their concerns for her daily.
They're scared. They know that I'm exposing myself or that I can have contact with somebody who has the COVID-19.
District 5 makes up only 8.5% of the city's population. According to Metro Health, it has 14.5% of coronavirus cases and 21% of coronavirus deaths. The district also has high rates of diabetes, obesity, and heart disease. It's why Gonzalez has launched a grassroots effort going door to door talking prevention in both English and Spanish, with special emphasis on social distancing and avoiding large family gatherings.
I think our culture is one to celebrate, and so we often have graduation and Easter and Mother's Day and multiple gatherings that we really depend on to stay connected.
Now, on the path forward, for the first time in the long time of the community's positivity rate is slightly below 6%. It's now at 5.9%. The community moving closer toward its goal of 5%, the rate recommended by Metro Health to allow more in-person learning. Tomorrow, city and county officials will have an update on schools and COVID-19.
Melissa Vega at the Education Desk, where one of the largest school districts in town is showing you how students are getting hands-on learning during this time. A perfect flower arrangement can only be achieved through practice, right? Well, students in the district's Agri-Science Magnet program are able to spread out in an arena and make their very first flower arrangement. Students with a passion for floral design had the opportunity to get their Texas Master Florist certification. And part workshop, part classroom. Other NEISD students are practicing welding and power mechanics in a lab. The district saying this is being done safely in small groups. One student says he likes the hands-on experience, and the district is proud to be teaching the next generation of workers. Of course, we will continue to showcase these stories for you.
when you're outside, it does not mean that the air will completely dilute if someone coughs or sneezes.
New information tonight. A UTSA professor says COVID-19 can spread up to a mile outdoors. News 4 San Antonio's Alejandra Guzman is here for you to explain the data and how it may impact you.
As temperatures cool, more people are heading outdoors.
I'm walking, fast pace, listening to my music.
Weather conditions, a local UTSA professor studied to see their impact on the spread of COVID-19.
If you have an infected person, and if they release any cough or sneeze, what happens outdoors?
I don't know if somebody coughed right before I got through here. So, I wear it for my safety, and then when I get home, for my mom's safety.
While people remain split on whether to wear a mask outdoors, we asked the expert for you. Can wind spread COVID-19?
Seeing conditions such as low wind speeds of 5 meters per second and something around that, something we need to be more concerned is then the outdoor spread could be a big factor.
The professor says her study, conducted in New York during the height of COVID in March and April, indicates strong winds can help mitigate fluids. An infected person coughed or sneezed.
What happens is they do survive for close to 30 minutes and without getting diluted into the plume, and they also travel to a distance of a maximum of around 1 kilometer before that puff of plume gets diluted with the outside air.
Does it make you think twice about wearing a mask while you're outdoors?
Not would.
This is the purpose. I'm in a lake where it's very, secluded and there's no people. I'm still wearing my mask.
The professor says 6 feet of social distancing is not enough, and it should be even greater when we're outdoors. She says as we continue to see community spread cases of COVID-19, we should continue to wear a mask even when no one is around. Randy.
All right, thanks, Alejandra. And digging deeper now, a News 4 viewer reached out to us about this study after we first shared at 6 o'clock here, as they were under the impression that COVID-19 dies in direct sunlight. So we looked into that claim. According to the National Academy of Sciences, Engineering and Medicine, well, scientists are still researching whether or not the sun's ultraviolet light actually can kill COVID-19.
It's unconscionable. It's a shame to senior citizens and people on disabilities.
We're here for your health and your money. Our troubleshooter looks into what's at play when you pay for prescriptions, what the White House wants to see carried over to you to lower your cost.
Another cool, crisp night ahead of us here, and there's another cold front down the road when this one moves through, if it brings any rain, and how much cooler behind it in your 4-zone weather.